Do a physical exam. Have you ever had one done before? Okay, can I get your name and date of birth?
Lindsay Winters, 5'2",
And do you know where you are right now?
Madisonville Community College,
And what year it is?
2019.
And who's the president?
President Trump.
Okay, so patient is alert and oriented times 4. We're going to be going from head to toe, as you know, since you've had it done before. So we're just going to start with your vitals. Okay, so it was 132/70. For your blood pressure, now I'm going to check your radial pulse. Okay, radial pulse is 76 and respirations are 16. I'm just going to look at your skin. It is dry, it's intact, warm to the touch. Skin turgor is good. Cap refills less than 3 seconds. There's no masses or lesions noted on the arm area anywhere. Now I'm going to look at your head. Also, your color is good for ethnicity. I'm just looking for any masses, bumps, lesions. Have you had any painful areas on your scalp? Okay, I don't see any parasites or anything. Hair is distributed evenly. It is brown. Okay, I'll wash my hands. Now your head is symmetrical to your body. You have well control of it. The size is normocephalic. Now I'm just going to palpate your sinuses. Tell me if there's anywhere painful. Okay, I'm checking your temporal pulse on both sides. And it is palpable. I'm going to have you squint your eyes and then puff your cheeks. Cranial nerve 7 is intact. Can you move your jaw? That's cranial nerve 5 intact. And the temporomandibular joint, was there any pain with it? Okay, so that's good. I'm going to go on to your ears. Have you had any painful areas on your ears? Okay, so no masses or lesions are noted. All right, I'm going to pull up and back and look. Tympanic membrane is pearly gray and visible. There's no drainage noted, no masses or lesions, redness inside of the ear canal. And now I'm going to stand behind you real quick. I'm going to whisper a word. If you can hold one ear closed, just repeat it back to me. Football. Okay, that's cranial nerve 8 intact. I'm going to look at your nose. If you can just look up. Septum is not deviated. There's no abnormal drainage or redness. The mucous membranes are wet. Nose is symmetrical to the face. Can you close one nostril and breathe in? And on the other side? Okay, so that is patent. You didn't have any trouble breathing? Okay, close your eyes for me. Just tell me what you smell.
Alcohol.
All right, cranial nerve 1 is intact. Now I'm going to look in your mouth. All right, if you could say "ah" for me. Uvula rises with speech. Tonsils are grade 1. Hard and soft palate is both dark pink and light pink. Can I see under your tongue? That's dark pink. You have 30 teeth. Your buccal membranes are wet and moist. There's no masses, lesions noted on the inside of your mouth. Can you move your tongue side to side? Cranial nerve 12 is intact. And can you swallow? The gag reflex is also intact. Cranial nerve 9 and 10. Okay. Wash my hands again. Now I'm going to go to your eyes. Have you had any problems seeing anything like that? Okay, pupil size is a 3 millimeter. They are round and they are symmetrical to the face. Now if you can just look at my shoulder. Okay, and follow the pen light. Direct and consensual response is intact and accommodation. Now follow this. And cranial nerve 3, 4, and 6 are also intact. Pupils are equal, round, reactive to light, and accommodated. Your conjunctiva is pink. Sclera is white, eyes are brown. The external fixtures of your eyes, the eyelashes, and eyebrows are normally distributed and intact. Now I'm going to move on down to your neck. So you can push against my hand. Okay, range of motion in the neck and muscle strength is a grade 5. Can you turn your head right and left? Okay, control is all right. There is no JVD, pulsating, anything, no masses or lesions on your neck. Do you have any tenderness? Your trachea is midline. I'm going to feel your carotid pulse. That's a +2. Bilaterally, it's +2, so that's good. Now I'm going to do your lymph nodes. So we have the pre-auricular, post-auricular, the occipital, and then the tonsillar, submental, submandibular, superficial cervical chain, deep cervical chain, posterior cervical chain, and supraclavicular. None of those are palpable, so that is good. And now we're going to go to your arms. If you could squeeze my hands, okay, and then pull back, push forward. So muscle strength in hand and arms is a grade 5. Can you do this for me? Okay, fine motor skills are intact. Can you shrug your shoulders? Okay, cranial nerve 11 is also intact. Muscle strength of shoulders is grade 5. Can you move your wrist up and down, side to side? Range of motion in wrist is good. Can you move your elbow? Range of motion in elbow is all right. And your shoulder up and down. Okay. And I'm going to check your joints real quick. Do you have any abnormalities that you've noticed? Any pain in the joints? Okay, I'm checking the epitrochlear nodes. None of those are palpable. Your skin is normal to ethnicity, is dry, intact, no lesions noted on the arm or anything. I'm going to check your brachial pulse. That's a grade 2. We checked the radial, it's a grade 2 also. Okay, now I'm going to listen to you. I'm going to do the anterior breath sounds first. Have you had any difficulty breathing or anything? Okay, so there's no masses, lesions on your chest, no tenderness noted. Okay. Okay, we're going to listen to the posterior breath sounds. There was no adventitious breath sounds on the anterior side. Configuration is a 2 to 1. There is no masses or lesions on the back. Real quick, take a deep breath. Chest expansion is symmetrical. Okay, so you didn't have any difficulty breathing. There's no adventitious breath sounds. It all sounds good. Now I'm going to do your heart sounds real quick. Okay, on the right sternal border, second intercostal space is the aortic valve. Left sternal border, second intercostal space is the pulmonic. Third intercostal space, left sternal border is the Erb's point. Fourth intercostal space, left sternal border is tricuspid valve. And then fifth intercostal space, midclavicular line is the mitral valve, and I'll listen to that for a full minute. All right, the mitral valve rate was 76. Now I'm just going to have you lay down. Right rhythm of the heart was also normal. No murmurs noted. Okay, I'm going to listen to your bowel sounds. When was the last time that you had a bowel movement? This morning. Okay, and any changes in urinary frequency, pain? All right. I'm going to listen to the right lower quadrant, and then the right upper, then the left upper, and the left lower quadrant. Bowel sounds are normal active times 4. If they weren't, I would listen to it for a full 5 minutes. Do you have any pain or tenderness? Okay, the umbilicus is midline. It is inverted. There's no pulsations or anything abnormal. No tenderness, no masses or lesions noted on the abdomen. Now I'm going to have you do range of motion with your ankles. Can you go around and down and up? Okay, range of motion in ankles is all right. Can you bend your knee up? All right, and put your hip out for me. So range of motion of the knee and the hip are intact. Now you can sit up. I'm going to go ahead and put on my gloves and check your feet. Can you push against me and pull? Okay, muscle strength is a grade 5 in the legs. Can you push up and push down? Muscle strength in the feet is a grade 5 also. I'm going to check your legs. There's no edema noted. The hair is distributed evenly. I'm going to check the popliteal pulse. That one's not palpable. I'm going to check your posterior tibial. That is a 2+. And the dorsalis pedis. That is a 2+ also. Your legs are symmetrical. Your feet don't have any messes or lesions. I would check cap refill if you didn't have on toenail polish. There's nothing on the bottom of your feet. And now I'm going to check your quadriceps reflex also. All right, that is intact. I think that is all for our physical assessment. So thank you.